My name is Michelle Shankar. I'm a general pediatrician and clinician researcher at the Children's Hospital at Montefiore. As pediatricians, we often focus on the patient in the exam room. We look at their growth chart, we review their vital signs, we ask about symptoms of any illnesses that they might have. But what those questions don't totally capture is how that child's health impacts their ability to function in their day-to-day life. And a key indicator of that is their ability to be present and engaged in school. So our study looks at how school attendance might help us to understand a child's overall function and well-being across health and academic domains. Yeah, our study showed that children with anxiety and depression were more than 3 times as likely as their peers to have health-related school absenteeism. This could be due to a variety of factors. This could be school refusal, poor engagement in the school setting, or behavioral concerns resulting in things like out-of-school suspensions, all of which lead to missed instructional time. So our study starts to suggest that school attendance may be the first signal to a child's family, school, or healthcare provider that there's an underlying mental or behavioral health need. And given the sharp increases in youth mental health needs since 2020, I think this is something that we should start paying attention to. Exactly. Our study showed that compared to children who don't have any chronic health or social needs, children who had any household related social needs, like you mentioned, housing instability, food insecurity, they were twice as likely to have elevated health related absenteeism. And kids with health and social needs combined were more than 5 times as likely. So we know that these social needs and the home environment can play a big role in a kid's well-being. The first step is screening for those needs in clinical settings and having systems in place for patients who disclose those needs. Here at the Children's Hospital at Montefiore, we have a universal social determinants of health screener that all patients receive, and those with positive screens are referred to community health workers who can connect families to resources and follow up with them until those needs are met. Yeah, my dream is for a pediatrician to be able to open a child's chart and look at their growth curve, see how they're growing, look at their blood pressure, and look at their school attendance as vital signs of their overall health and well-being. And if something's abnormal, this can open a door to a conversation about what might be going on. Until we have the infrastructure for that, simply asking families about their school attendance can be a meaningful place to start. If a child has missed 2 or more school days in the last month, they're actually considered to be chronically absent, and there's an opportunity to partner with families to support their child's academic success. Yeah, although we care for and often worry about the same kids, our health and school systems are pretty siloed sectors. And right now, the burden for improving school attendance really falls on schools. But our study shows that many of the underlying reasons for those school absences are related to a child's health, and those are things that we can support with. To address this problem together, I think we have to bring folks from health and education sectors to the same table to start designing solutions together. I can see 2 big opportunities to build bridges between these sectors. One is creating infrastructure for communication for teachers, school-based clinicians, and healthcare providers to work together to support students. The second is to share school attendance data with healthcare providers so that we can help to identify and support children who might have underlying health and social needs. Our study contributes to a growing body of work that's reframing school absenteeism as a public health concern. Schools and health systems across the country are starting to build these bridges, and I see this as the way forward to improve health and academic outcomes for our nation's children.